All right, so what we do, we'll go to AetnaSeniorProducts.com. This is going to be the home page. Let's go over here to the login agents. Now, I've already registered here, so all my stuff's defaulted, but you can go to register now if you haven't already do that. So let's get logged in here real quick. So what this is going to be is Aetna's homepage. As you can see here, Aetna, this is my information, but home, products, incentives, my business, training, communication, contact us, just different tabs, pretty generic. But what I want to do is draw attention here to Aetna quotes and enrollments. So what we can do is the sandbox lets us play with the app. So let's click on that real quick here. So this is going to take us to the sandbox. It's just a demo site that I can show you guys. So we won't be able to go through the whole app, but a good chunk of it. So let's do this. Let's make up a client. Now this is going to be completely healthy, but let's just do someone here in town. So 68701, date of birth, July 23rd, 1947, puts me at 72. Let's go effective date, August 1st. I am a male. No tobacco, but I am today John Doe. Let's put the office email here so then we can go. Phone number 402-506-9063. All right. Now what we can do is view the products. Now this is going to be all the products that we can select from, but what I want to do for this is show you the final expense Ascendo Insurance Company. So let's click on that plus sign here. Here it is. Applicant A, John Doe, that's me. So what we can do here, I want to change the benefit amount. Let's do just $10,000 for this. But we need to click on that preferred level. What that does is kind of unlock some things, but let's click quote. And what that's going to do is bring up the quotes for all the preferred level here, the standard level, the modified, and then that super preferred plan. Remember, if they have a med sup, they can qualify for that. So 8453 is the quote that we're going to be doing. So let's add to cart. Now, as you can see, John Doe, here we go, 8453. But first, we need to send an e-kit. So the e-kit basically is information that's going to be sent directly to John or the client. John Doe, the email address, my email, and just basic information, the product brochure, the applicant information, the receipts, the product statement, just general information is going to go to the client. You can see my name here as the writing agent, my email. Let's send that e-kit. The applicant ID is 176465, sorry. So let's click OK on that. Let's exit out. And then we need to come over here and start the enrollment. So this is going to be pretty easy. First off, John Doe, date of birth, are you a legal resident? Yes. Now, I'm going to be doing this just as a general healthy client, so no health issues. So plan history, health history, benefit plan, proposed insured, payment, agent information. So these are just the different layers that we're going to go through. But again, healthy client here. We're not going to have any health issues just so we can get through this pretty quickly. Now in Section A, so if you answer yes in Section A, you are not eligible. You will not be able to complete or submit this application. So if you answer anything yes here, you're not going to be able to pass. So let's answer everything no. You're not currently in a hospital, so we can go no. Hospice, no. Wheelchairs, no. Within the past year, no, we don't have any of these issues. Remember, we're a healthy client right now. Make sure you are asking these whole questions. Have you received? No. Bone marrow? No. No AIDS. Have you been diagnosed with Lou Gehrig's? No. Alzheimer's, dementia, congestive heart failure, so no. All these are going to be no. Within the past 2 years, diagnosed? No. Diagnosed? No. All right, so let's click that. Now, Section B, if any yes answers in Section B, you're eligible for the modified plan. Remember, return a premium plus 10% on this one. Within the past 2 years, you received treatment for medication, for alcohol or drug abuse. No. Diabetes, kidney or liver disease, no. Within the past year, being diagnosed with, no. No. All right, now we're down to Section C. If any yes answers in Section C, you're not eligible. You are eligible for the standard level plan. If all no in Section A, B, and C, you're eligible for the preferred plan. Now, within the last past 2 years, no. No stroke. We go down here. No, no. Now, what we can do is click the check availability, and what this is going to do is tell us if we qualify. As you can see here, we answered everything no. We may qualify for that preferred level. So the next section is going to be the riders, the children's term rider. Again, just for the sake of the application process, show you how simple this is. We're just going to say no to these riders, and we're not going to be replacing anything. So let's just click no here. If you are replacing or you do want the rider, you'll just click yes. But for the sake of this argument, we're just going to say no to both the riders and the replacements. So we select both those no. Let's just scroll down here a little bit. Are you considering making payments, surrendering, forfeiting? No, we're not doing that. Or are you considering using the funds? No. So let's just click next here. This is pretty simple, straightforward stuff. Very generic, very basic. This health history, this is for anything that you want to tell the underwriters. What you were diagnosed, dates, duration, medication, dosage. These are just notes that you want to let people know on the underwriting side of things. So let's click next here. Now we are going to go to the Medicare supplement. If you have a Medicare supplement through Aetna, remember you get that discount of 10% on the final expense quote if you do have it, if you qualify for the preferred. But we're already taken care of, so let's select no on that. Now, the insurance which you may qualify has a return of premium death benefit for the past 2 years. The amount of coverage applied for may be less than the amount approved. So are you willing to accept a different plan? No, we don't want to do anything like that right now. We just want to keep it basic. So we come down to the riders. The accelerated death benefit's already included in that, so we're set. If a non-forfeit option is not selected, you'll be getting the extended term insurance. So let's just click that real fast. All right. So now we are to the beneficiary information. So John's married. Here we go. Betty is her name. Betty Doe. A great individual. But she gets 100% of the death benefit. Again, 402, 506, 90, 63. Email, let's just go back to endowed. That's me. So let's get that typed in. Address is 705 West Benjamin Avenue. Let's go there. Here in Norfolk, Nebraska, 68701. Next. All right, so applicant John Doe. Review the product details. Click OK if you need any changes. Cancel those to make the updates. Effective date, yep, we're good there. Direct bill, not available. All right, let's keep moving forward. This is very easy, guys. It doesn't take you very long. Again, these are just simple things, but now it's the agent or client information here, so let's just go back here. 705 West Benjamin Avenue. Let's type that in here in Norfolk. Phone number, we already did that, so let's put in the social security number. 1234 234 12345 1234. Okay. Have you used tobacco in the past 12 months? No. Is the mailing address different? No, that's all the same. Next. All right, so we need to just verify that real quick here. So let's select that. Proceed. That verifies the address here. All right, now we need to get into the payment information. So I'm not putting in the actual banking information, so we're just going to make up some information here. So let's just put in a routing number. Here we go. Obviously, yep, it's a fake bank. Let's have some fun with this. So we'll do Premier and Nate. And it's a checking account. And then account number 1001 01234 1001001234. Now we need to come over here and select add. And what that's going to do is just add that into the little queue here for us so we can save that for later. Here it is. Now what we can do, final expense here, payment method. So we drop that down. We have EFT or Social Security billing. Let's do EFT because we made that up. Now we would just select that account we put in there. And then the draft date, the 1st. Let's get that. And then we just hit next. This is very easy, very quick. Now here's all the basic information about the agent writing number, yourself, the product, commission amount, 100% there. So what we need to do is send the policy to the applicant here. So let's click on applicant. That's really the only option we have right now. So we need to do that electronically, and it's going to ask you to email again. So there's that email. Now it's just information from the agent notes. I have no notes on this one, so next. So now we just need to do a quick review of the application here. So this is all looking good. This is looking good. 8454. So now we need to get to the signatures. This is the part that I like. So let's click Start Signature Process. Now we have a couple different options. So this in person, if you're going to be doing this using the paper application, you have that access, but I want to do email real quick. So the email signatures, you click verify the email ID, send the email to the applicant. The applicant uses the last 4 digits of the Social Security as a password to open the application. The application, to review the application online and apply the signatures for the documents. It's pretty self-explanatory if you've used the DocuSigns before, but I want to show you the security question. This is pretty slick. So by providing an answer to a security question, you will choose you confirm your intent to apply for insurance and your consent to receive electronic consumer disclosures and related documents. You confirm that you are receiving and were able to review the following electronic documents, basically this electronic delivery receipt, all this different information right here. So here's the 9 questions. I'm just going to select your favorite color. I'm from Nebraska, so it's red. So I'm going to say that, agree to terms. Now I'm applying the client's signature here by just asking that security question of what's your favorite color. Now here's my signature. All I'm doing is clicking I agree to the terms. I apply the agent's signature, and that's it, guys. You'll submit the application here. Now remember, I said this was a sandbox, so we're not going to be able to get that instant underwriting decision like I want to show you guys, but that's what the next step is with that. As you can see, this is super easy to complete. Check it out, guys.